Well, good morning, everyone. Thank you for joining us and welcome to the first in our series of webinars on telemedicine. First, I hope everybody out there is staying safe and healthy. My thoughts and prayers are with those who have been inflicted with the virus, and much appreciation, love, and gratitude for all the doctors, nurses, and first responders out there, really true heroes. So I've assembled an amazing team of panelists and a surprise addition panelist, Sean Callagy.
Hey, how are you?
Hey, Sean, I'm well, thank you.
Yeah. Hey, listen, first I just want to jump in and apologize to everybody. We're just getting this all launched. We will be on 5 minutes early next time. Hala's done a beautiful job. That's not on Hala. We will have this set up technologically phenomenally next time, so we're ready to go hit the ground running. So Hala, I just want to acknowledge you and thank you. Everybody on the line, I want to thank you for being here today. So Hala, why don't you introduce the rest of the panelists, and I'll jump back in a little bit. I just want to say a quick thank you.
Thank you, Sean. Thank you. And the fact that Sean is on, I got to tell you, it's an amazing thing, but I have mixed feelings only because it's always amazing to have Sean, but it makes me a little nervous because Sean is actually a national public speaker. He is the best public speaker in the world. He's addressed audiences of hundreds of thousands of people. So it makes me a little nervous, but thank you for being
on. Well, Hala, that is overly complimentary, and I will tell you this. That may be true, but Hala can out-negotiate me on a bulging disc, herniated disc, and every other kind of personality case because she has read the book Never Split the Difference, and she's certainly within our unblinded formula, and she is a straight-up rock star that could teach me a ton of things about negotiating over the incredible quantity of things she negotiates. So, Hala, phenomenal job, and thank you again, everybody, for being here. What else we got?
Thank you. So, so obviously, if there was ever a critical need for telemedicine, it is now. So, on a personal level, when I think of me and my loved ones, I want to have that option, especially at this time where we don't want to venture out. But also as a personal injury attorney, a person who represents injured clients, you know, I worry about their ability to continue with their treatment, not just from a medical standpoint and their need to have their medical needs addressed, but in order to prosecute their claim properly, we need to show that continuity. So if you're not up to date with the latest technology and innovation with regard to treatment and telemedicine, it's really a disservice, not just to your practice as a practitioner, as a doctor, but also to the patients out there. But without further ado, I would like to introduce you to this amazing panel. You just heard from Sean, obviously, my partner, Sean Callagy. We also have Michael Smikin. Michael is our litigation partner. Michael is a relentless guardian leading a team of gladiators. Michael, wow. He's also been recognized for 2 top 100 national jury verdicts. Michael has represented clients in the state and federal level, including the New Jersey Supreme Court and the U.S. Court of Appeals. Thank you, Michael, for being here.
Thank you, Hala.
Yeah, but Hala, can I just say this? So what's much more important, I think, is that Michael has a record that I believe stands in this country and is unparalleled. I believe Michael Smikin has changed more diapers and read more bedtime stories than any litigation attorney in the country. And I will tell you, and I mean this with all my heart, that that's the thing I love and respect most about him.
Oh,
so Michael,
he is an amazing father. He is an amazing father.
Thank you, guys.
Yes. And we also have Mr. Tom LaGreca. Tom is the executive director of our medical revenue recovery. He is the most hardworking. He is in the process of assembling an ebook regarding telemedicine, which will be coming out soon. Hello, Mr. LaGreca.
Good morning, everybody. Thank you, Hala, and thank you all for attending.
And we have Mr. James Winston. James is the managing attorney for medical revenue recovery. James has also lectured on topics of PIP and no-fault recovery for New Jersey ICL. He's also recently met with the Dobie Commissioner, he is very knowledgeable in the area of medical revenue recovery. Thank you, James, for being here.
Morning, Hala. Thank you for having me. I'm happy to be here, and thank you and welcome to everybody on the line.
And James competes with Michael for diaper changing and bedtime stories. And Tom Agreka is writing the Novel to End All Novels series of books about everything and the history of all religion combined and all breakthroughs with his son. So this is a panel of incredible family people.
Yes. And finally, last but certainly not least, Dr. Jacob Reinkraut. So Dr. Jacob Reinkraut is a board-certified foot and ankle surgeon and podiatrist. He's also the chief of the foot and ankle department at St. Michael's Medical Center and the head of the residency program. Dr. Reinkraut has been practicing telemedicine. Thank you for being here, Dr. Reinkraut, and welcome.
My pleasure. Thank you for having me. And I also changed
my... Thanks, Doc.
All amazing fathers, by the way, all of them, including Mr. Callagy himself, an amazing dad.
No. And we would be remiss not to acknowledge the mom that Hala is, and she is truly, truly somebody that walks her talk and lives an incredible life of dedication to not only her business and growth, but to her family. Her habits, her morals, her construct, her integrity is off the hook. So Hala, thank you.
Thank you, I appreciate it. So before we get started, Sean, you know, I just wanted to ask you this morning, what is present for you, Mr. Callagy? You want to share with us a little bit?
Yeah, so I would say what's present for me right now, and, you know, each day I run something called the Unblinded Huddle. And, you know, we have, 500 plus people live, thousands of people watching replay. And what has been present on those huddles, the business people from the state, the country, all over the world, obviously is fear, uncertainty, and massive trepidation. And what I've been sharing with people on the huddle, and I'll share it with you here, is that I don't ever want to see anything worse than it is. I'm a positive person and optimist, but I also don't believe in seeing things better than they are. And when I say that, though, I think a lot of times we can, when we're thinking we might be seeing something better than it is objectively, what we're often missing is the reality of what's possible. And so I think there's an adventure, an opportunity, an opening in this telemedicine space, and that we're talking about. And we're going to talk about the legalities, the practicalities, but I'll also say this, and this is what I've been telling my own team. I have 125 employees-ish at Callagy Law. I own the Unblinded Corporation. We have 10 plus employees. I have a startup launch company called Proximity. We have close to 10 employees for Proximity. So there's a lot of folks that we have out there working and being challenged, and they're working from home, some in New Jersey, some all over the country. And what I've been sharing is I would be preparing to be dealing with this crisis for 6 months plus. And when I say that, people get upset. And they're like, it's not going to be that. We're going to be back to work in 2 months. I'm like, listen, if we're back to work in 2 months, then all the better. If we're back to work, God, I hope these innovations that are occurring medically, with some of the things they're prescribing at this point and getting approved by the FDA, I hope these things work and completely change the trajectory of everything and make it safe for us all to go back to work and be in our offices. What I'm doing and I'm preparing for is to not be working physically in proximity to anybody for 6 months. I hope that's wrong. And if you're on the line, go, that's ridiculous, that's crazy. Why would you? Listen, prepare any way that you would like, it's fine. But I'm preparing that way to asking myself the question, if it is 6 months, how do I survive? How do I accelerate even? What value can I add to my client base, the people we work with in every industry? This call is an example of that. The calls you may be doing or utilizing telemedicine, webinars, conversations, accelerating the value you add for your patient base and your referral base. That is where I would, with all my heart, be suggesting you're thinking lie right now. And I said it this morning, a 7 a.m. huddle, I had an 8 a.m. huddle, an 8:30 huddle with internal and and then the external Unblinded Huddle, with all of our teams in the Unblinded ecosystem, what I've been sharing is, if we're treating this, you know, and I'm not saying you are, but your staff or referral sources, anybody you know, is treating this as a summer vacation, a quick break, I think mentally we're going to lose traction massively. And if it ends up being a much longer period than some might be thinking, we're going to be in trouble trying to recover. So I'm treating every day as the last day I have to work in my life right now and build, in addition to connecting with family and loved ones, right, which I'm doing every single day. But what's present for me is not only surviving Hala and everybody, but accelerating right now and finding every way I can add value to everybody I'm connected to and the world at large. And that's what I'm present to. And for any of you that want to start your day with learning about how you can create webinars, ecosystem merge, go from hello to yes with a higher degree of acceleration and mastery, we do the Unblinded Huddle every day. And it's with a world-class team and people. And every day we're having people on television, people that are incredibly successful entrepreneurs in and out of the healthcare industry. And if you might want to be a guest, please let us know. But it's unblindedhuddle.com. It's free. Please register and be there. What is present for me is possibility, and that's what this webinar is about. So please continue.
Thank you, Sean. And just to second that, I start every morning at 8:30 with the Unblinded Huddle. So it is something that everybody out there watching should really check it out. It's a great way to start the day. And, you know, Sean, just this time, I think it's also a great time to innovate and create because we have access and it's a great time to connect. So thank you, Sean. I guess I want to start with Mr. Smikin. Mr. Smikin, I guess the question that I want to ask is telemedicine available and open to any provider, any doctor, any practitioner, or are there limitations?
Sure. So the answer is yes, so long as you are licensed with the state of New Jersey and you follow 3 other requirements. The answer is yes. So this applies to physical therapists, it applies to chiropractors, it applies to surgeons, neurologists, it applies to everybody. So telemedicine is available. And Hal, I think it's really important that we define what telemedicine is. And what telemedicine is it's interactive, it's real time, it's two-way using communication technologies, right? It's not email, it's not text messaging, it's not anything along those lines. It's got to be interactive, it's got to be real time, and it's got to be two-way. So that's what telemedicine or telehealth is. It doesn't necessarily require video, but most of it should be. And because the technology the way it is now, it's completely available.
Thank you. You said there's, as long as they follow 3 requirements. Let's share with everybody on the webinar what those 3 requirements are, please.
Sure, it's 4. And so what you see on the screen right now is a PowerPoint that was prepared. I'm going to make this available to everybody, so you don't need to take notes on it. But if you go to the 3rd slide, 2 more down from here, you got, can we go one more? Beautiful. See, you got the validly licensed, certified, or registered pursuant to New Jersey law. You have to be subject to the regulations of the state licensing board or regulatory entity. You have to act in compliance with existing requirements, and you have to maintain liability insurance, very important. And you have to remain subject to the New Jersey jurisdiction. Either the patient or the provider has to be located in New Jersey at the time that the services are provided. So those are the 4 basic requirements.
Thank you. Michael, you said you have to maintain liability insurance. Is that the existing liability insurance that the provider has, or is there an additional requirement if you're practicing telehealth or telemedicine?
So it's, and I think I'll be able to answer a boatload of questions with this. Telemedicine is governed in almost the same way an in-person meeting or treatment would occur. And so it's a supplement to and not a replacement of. And so whatever questions you may be having, like, well, how do I do it differently in telemedicine? The answer is you would do it exactly like you did in an in-person meeting. So it's your existing liability insurance, right? You have to maintain your liability insurance. So you should not be, for example, calling your malpractice policies now and telling them, hey, I'm not working. Can you term or suspend my malpractice until my office opens back up? And then pick up the phone or video chat and start doing telemedicine and not maintaining your liability insurance. So it's whatever you would do in person, you're doing on telemedicine plus.
Okay. And Michael, does a provider have to provide to notify the state, the Board of Medical Examiners, that they're now practicing telemedicine? Are there any certifications, anything, anywhere they have to register?
No, so the law, and by the way, in the PowerPoint, I include the law and I allow you to go and read it. Telemedicine is now available, and it has been since 2017, but very few providers have actually availed themselves or needed to do it. So you just got to be licensed, certified, or registered with the appropriate state licensing or regulatory entity to perform the services that you're already providing in person.
Okay. And I just want to clarify again, because I think a lot of people on this webinar would want to know, it also, even if you're, a chiropractor, physical therapist, you can practice telemedicine. Is that right?
Yeah, and I'll make this really quick distinction, but I think James is going to be talking a lot about this. There's a distinction between performing telemedicine and getting reimbursed for performing those procedures. So you should not be thinking about them as one concept. The way you should be thinking about this is, how do I continue to maintain my practice, maintain my clients, build a new client base by providing services that are necessary to my community, to my patients, to patients who will be reaching out and looking for telemedicine and not wanting to come in doctor's offices primarily. Secondarily, there's the reimbursement or reimbursability of those services, but I think James is going to be talking about that. So yes, chiropractors can do this, but you can't bill for a spinal manipulation that you didn't perform. The same rules that apply for an in-person apply for telemedicine. So you can't have a person perform their own spinal manipulation and then bill them for it.
Thank you for that. And also, it's a good time. Sean, are you with us?
Yeah, I'm here.
Okay, so I just wanted, Michael was talking about, it's a good time to build practice. I wanted your thoughts on that. A lot of people are now sort of like, there's nothing I can do, whatever their business may be, and sort of say, let me wait. What do you think about that? I think it's a great time to create and build.
Yeah, so that's a challenging thing to land for some people. Mm-hmm. And so here's what I'm present to. I'm present to that a friend of mine that I coach my kids with died of cancer 2 days ago, and he couldn't have a funeral. I'm present to the fact that there are people that I know in my own family working in hospitals. There's a dear friend of my family who contracted corona working at Holy Name Hospital in Teaneck. I am present to the fact that unbelievable insanity is going to be ensuing over the next month in New York and New Jersey in our nation. So I'm present to all of it. I'm also present to, I can't control any of those things other than keeping myself isolated, right? I have empathy, I have caring, I've shed tears, and I am treating this as an opportunity and a challenge. I'm treating it as a challenge to not let the forces of heaviness and darkness, this disease, this condition, stop what I believe is my purpose in the world, and to stop the people that I love and care about and connect with, which, by the way, is every human being with boundaries, right, from accelerating. So yeah, I do think it's an incredible time to accelerate because people need things they're not normally aware that they need. Your patients need your love, connection, timing, attention, energy, or your staff. Referral partners need hope, validation, listening. Like, we need to just be there and be real with each other and for each other at an unprecedented level. And that creates an extraordinary opportunity, in the best sense of the word, with integrity, to add value for people. So I think there's massive opportunity. And again, this is not a sales pitch. This is a promise. Get on the Unblinded Huddles for a week, and then tell me you're not seeing access to how to accelerate through using things you've never thought of before. And just the innovations we're creating in Callagy Law, including this webinar And all the things that we're doing never would have happened if the corona didn't happen. We've been talking about doing certain things. I'm doing a bunch of things. Some other people doing some. Others have been doing none of these things. And there's been a massive innovation in the past 2 weeks just in what we're up to and what we're doing in service of getting like the amazing things that each of these people can do out there. And you can do amazing and incredible things, and far less people know about how incredible you are than should. And so it's an incredible time to do that. So yeah, I am saying grow now. How to? That's not what this webinar is about, but grow now. Thanks, Hal.
Thank you, Sean. By the way, I want to mention that we'll reserve the last 15 minutes for questions. If you click on the icon on your screen, there is a place for chats and questions. I think there also might be something to raise your hand, an icon, and ask a question. But getting back to Michael, if you could explain a little bit about the nuts and bolts of it, like how does a doctor establish the doctor-patient relationship in telemedicine? If they're on an audio call, how does that work?
Yeah, sure. I mean, look, there's no way, unless you're going to give me 45 minutes to an hour to explain every one of the nuances of it, that I can do that. And because of that, I put more slides in and also a citation to the actual code that dictates how you move forward on this. But probably the most important elements is, element number one, you have to establish the licensee-patient relationship. You identify the patient and give certain PHI information. And I think the code specifically tells you what kind of PHI to provide. You also have to identify yourself and talk about who you are. And your qualifications and things of that nature. So once you've established that relationship within the telemedicine category, you then initiate contact. If it's a new patient who called in, you have to do something before you get on the first telemedicine call with them. And that is, you have to request certain of their information, gather certain demographic information, get a patient history, review all available records and things of that nature. In addition, this is the one time where telemedicine doesn't have to be interactive. You can use email, fax, text messaging to gather that information. And then the first telemedicine or telehealth meeting that you have to have reviewed that material before initiating that first telemedicine contact with them. And all of that is explained inside the code. I think I put it inside my PowerPoint presentation. If you have any questions with regard to that, I'm happy to answer any questions with more specificity, but the how is a very nuanced approach. It's not that much different than the in-person. There's a couple of additional things that you need to do. And I think one of the most important thing that providers need to know is they have to have a written protocol. And the written protocol has like 8 requirements. It's a good practice to have because right before you get on the call, you can check off that protocol and make sure that you've met all the requirements to really document that you did this appropriately and you initiated contact with the patient appropriately. But one of the things that you really need to be cognizant of, and I think that Zoom is really good for this, is the conversation obviously has to be HIPAA compliant. You need to save any records and make sure they're secure. And that you're documenting things appropriately with regard to your meetings with the prospective patient.
Okay. So just to highlight, if it's a new patient, there has to be action before the initial contact. Correct. Also, yes, this PowerPoint, which has a lot of information, will be made available. The documentation, is it different than it would be in an in-person evaluation?
So it's in person plus, like everything that you should remember for telemedicine is in person plus. And the code actually says what needs to be in there in addition to what you would normally include for documenting purposes within an in-person meeting. So it's that plus a few other things.
How about the identification, authentication of patients? Are there rules and requirements on that?
Mm-hmm. So yeah, what you need to do when you're making that first contact is you need to get at minimum the patient's name, date of birth, phone number, and address, right? You can also, right? This is a may, not a shall, right? So the first one is a must. The second one is a may. Get the patient's assigned identification number, so driver's ID number if they have it, their social security number, a photo, right, or the health insurance policy numbers, or other identifier associated directly with the patient. Those are mays. It's just good practice to have it for for your practice, and most providers actually do gather that information at an in-person meeting.
So Michael, what I'm hearing, it sounds like the requirements really are relatively simple. And from what you've read and your knowledge of the law and the legislation, it's not a complicated process. That's what I'm hearing.
Yeah, most of it is the uncertainty of doing something that you've never done before. But so you're going to have a lot of providers that are going to say, that's uncertain, that's scary, I'm afraid, I'm not doing this. And the reality is, it is not that complicated.
That's what it sounds like. Thank you. I want to shift a little bit, because I think that's a concern also for providers and patients alike, to Tom LaGreca and James Greenspan regarding billing. So my first question would be, is billing for telemedicine different than billing for an in-person client consultation, patient consultation with a doctor?
Well, let me just kind of kick that conversation off, and then I'll pass it along to James for the specifics. But similar to what Michael was describing in terms of the necessity for additional licensing, et cetera, the billing is something that is proceeding in a similar way, meaning there are codes that are billable when they are done in person, like certain office visits, et cetera. And they are also billable when they are done via telemedicine. So in a similar way that there are no impediments to simply proceeding in telemedicine in the same way you would if it was an in-person visit, the billing it's the same codes that are at work. So office visits would be billed with certain codes, whether they're in person, and now whether they are done via telemedicine, there are certain modifiers, certain place of service types of billing criteria that should be followed. And for those specifics, let me pass it along to James. But before I do that, let me just add one thing, Hala, on a general note. Telemedicine was the future, and the future is here. And the future has come in a much more dramatic way than any of us anticipated, but it is here. So every medical provider out there, if you're not doing telemedicine yet, you absolutely have to start. Whether we are ready for the future or not, it is upon us, and we have to act. Yeah. It's really that simple.
Hey, Tom,
is.
Al, if I can jump in there. Just real quick, guys. So, I have the privilege and from the organization I'm part of hearing some incredibly brilliant people speak on the cutting edge of the future, as Tom is saying. Peter D. Montez is a trained medical doctor, a graduate at MIT. And Peter, who I've had the honor of hearing a number of times speak at different, sort of smaller group settings in the Tony Robbins world, he runs something called Abundance 360. And what Peter's work is about what Tom just said, world in the future. And it's remarkable, I think, and some of you may be very dialed into this, some of you may not, how rapidly the world is changing. And each year, when you hear Pete speak from year to year, his talks demonstrate technological accelerations that are occurring in the world of artificial intelligence, the world of robotics, and the world of medicine. And the world we're living in today is going to look nothing like this in a decade, and probably look nothing like this in 5 years. So another unintended benefit of this catastrophic crisis we're going through, as I'm saying, is it's forcing all of us to confront ourselves and our conditioning habits to say, yeah, it's time to make these innovations and accelerations is now, because telemedicine is here, and there's going to be other accelerations and integrations occurring. And I cannot keep emphasizing enough, the relational dynamics amongst people are going to be the things that carry the accelerations of technology, plus the relational dynamics what's going to be the acceleration. And it's time for all of us to step into telemedicine as that next step into what's coming. Because other people are going to, and there's competitive dynamics that are going on in every industry, including the world of medicine with technology. And this is a small step forward to a critical one. So thanks, Tom, for that access.
Thank you, Sean. Yes, absolutely. We are in the future, and everybody's going to get on board. Otherwise, the bus will pass you by. Getting back to billing. James, Tom mentioned modifiers. Do you want to elaborate on that a little bit?
Yep, absolutely, Hala. Good morning again, everybody. As Tom mentioned, there are 3 specific modifiers that identify telemedicine. They are the GT modifier, the GQ modifier, and the 95 modifier. If we could just pull that slide up and get that in front of everybody. I don't know if we can, but essentially the GT modifier can be used for all interactive audio and video telecommunications interactions. I know that we had a question in the chat about whether the telephone was acceptable. Based on my research, it is acceptable because it's an interactive two-way, here comes the screen sharing, interactive two-way engagement between the doctor and the patient. The 95 modifier is for codes that are listed in Appendix P, as in Paul, in the CPT manual. So all this is on the slide here. You guys can check it out. And the GQ modifier is for the more rarely used non-real-time interactions, such as, if a doctor is reviewing a piece of radiology or something like that. It's one of the rare exceptions, but for the majority of the time, we're talking about either video or telephonic real-time back and forth interactions between the doctors and the patients that are going to get the GT modifier or the 95 modifier when you bill the codes. The other requirement is for the place of service. That's a question we're getting a lot. The place of service for telehealth is 02, regardless of whether the doctor is in his or her office or in his or her home. When they are conducting the interaction, you're still going to use 02 for telehealth. And lastly, as we touched on a little bit, Krista, if you could go, I think, 2 slides forward. Yep, one more. Yeah, right there. Thank you. There are 101 codes that can be billed with telemedicine. I'm not going to obviously go through all of them. The majority of them, as you would imagine, are things like office visits, initial evaluations, reevaluations. And as Michael was saying before, there are some requirements for what you need to do beforehand, and then there's documentation requirements just in person for the file that will need to be submitted. And I would say particularly important right now to do your due diligence with documenting everything, taking very good office notes, being quite thorough, because particularly, when you're dealing with telehealth, I think there's some skepticism probably that the carriers have. So I would make sure you are crossing your T's and dotting your I's.
I think, James, if I understand correctly, the rate of payment for telemedicine is not different than traditional practice. Is that right? Am I correct on that? That there's no difference? Because I think that's important to highlight.
Yes, that is correct. There's literally daily updates going on right now, as everyone can imagine, because of the crisis. So last week, New Jersey's Governor Murphy, as well as the New Jersey Department of Banking and Insurance, came out with Bulletin 20-07. And some of the stuff that's in there is now up on your screen, ensuring that the rates of payments are not lower when you're dealing with telehealth versus in person. So in layman's terms, what they're saying is you are going to be getting the same payment rates if you're doing telehealth as if it had been an in-person visit. Dobie has also said in that very same bulletin that they are eliminating, meaning specifically that a carrier cannot impose cost sharing. So what they're saying is basically you don't have to worry about the patient's copay, deductible, or coinsurance. The entire amount should be coming from the carrier.
That, I mean, so you're in a better position in terms of that if you're practicing telemedicine, sounds like. What about pre-certifications or pre-authorizations for treatment? How does that work with telemedicine?
Okay, so again, in that same bulletin, that's an excellent question, Hala. Dobie again says they are eliminating prior authorization requirements on medically necessary treatment that occurs via telemedicine. So that's a very interesting thing that Dobie has done, because if you're familiar with the PIP no-fault world or the workers' compensation world, you know that in New Jersey PIP, there's a pre-certification requirement across the board. So my reading of Dobie's emergency bulletin here is that they are now eliminating, temporarily of course, the pre-certification requirement for telemedicine visits in PIP. That being said, if a carrier determines that the telehealth visit is not medically necessary, you can still get a denial. So while the pre-certification is apparently being eliminated and no pre-cert penalty would apply, you could still be subject to retro medical necessity denials. Now, of course, that's not to say that 3 months from now, after this has all been billed with the proper modifiers and places of service and everything, the carriers are not going to start imposing pre-cert penalties. But that's the kind of area where certainly you would want to appeal that, and you're going to have to be vigilant in terms of collecting the appropriate reimbursement, knowing all the rules and regs that are circulating out there.
You said the pre-cert requirement is done away with for PIP and no fault. Is that the same for workers' comp and CI?
So the Dobie bulletin was a blanket bulletin that said that they're eliminating prior authorization requirements. So my reading of it would be that it's not only for PIP, but it's for workers' comp and commercial insurance as well. And again, in the workers' comp area, of course, you have to be, you need authorization in New Jersey. So my reading of Dobie's bulletin is that they're temporarily suspending the prior authorization in this bulletin, but again, with the caveat that it has to be medically necessary treatment. So it's not if a particular injured worker has been cut off or is the subject of an IME. I don't know that this is going to give carte blanche to providers to start, conducting telemedicine visits on a patient that's already been cut off because it needs to be medically necessary. But I think for new or ongoing patients, it looks like the prior authorization requirement has been waived totally across the board.
Hey, James, could I just add something really quickly?
Please.
I don't mean to complicate this, but, commercial insurance likely will be waived, but be mindful of the self-insured plans, because you could just imagine when all of this is over, those ERISA-based plans are going to say, well, I don't really care what Governor Murphy has to say. Whatever he says doesn't apply to me. And so, you had to have requested pre-authorization and those kinds of things. So just be mindful as it relates to the self-insured plans. I can see that being a problem. We hope they don't, but it could be an issue.
Thank you, Michael. Yeah, to clarify, all of this obviously applies to the state rules and regulations for each individual state. We're talking about the state of New Jersey now, so obviously anything federally governed is different. But also what I'd like to know is, I don't know, this is for James or Mike, if you are in network with an insurance company and now you're practicing telemedicine, should the contract be amended?
Well, I would think if you're in network and we're talking about an office reevaluation, you should expect to get paid the same rate for the televisit as you would for the regular in-person visit. I would think it's still going to be subject to whatever in-network rate you've agreed to in your contract, but you're still going to get that amount essentially.
Yeah, let me add something to that. The way most of these contracts are structured and worded, it's basically by CPT code. So most in-network agreements will have a universe of codes that generally are specifically mentioned in the agreement, and the office visits that would be billed under telemedicine, those CPT codes, because they're office visits and they're basic evals for the most part, would be covered in the agreements by virtue of the CPT codes. But my guess is now that this would become more and more popular, you're right, Hala, that to the extent telemedicine might have its own carve-outs in some way, shape, or form, that does become a more relevant concern. So I can see contracts going forward having a paragraph or two addressing the whole telemedicine scenario and how the agreements are going to address it. Until that happens, I think they would kind of come under the existing provisions via the CPT codes that would be getting billed.
Thank you, Tom.
Yeah. Hey, Hal, this is Sean real quick. What is present for me is two things real quick, maybe make a note. As we go forward, I can't wait to hear from Doc in a moment. But ongoing, we're going to be doing these weekly, and Hala is hosting. And if you are engaging in telemedicine, we want you as speaker, guest speaker in different specialties as we go forward. And also, please sharing your experiences, your challenges in communicating about it with your patients and generating a patient flow in telemedicine. These are the topics we're going to be discussing ongoing, number one. Number two, we'd love to talk to you and offer you our time in a whole variety of different ways. This just popped up for me because we had it on an earlier call. You have the bill that just got passed for getting funds for your employees, loans that can turn to grants. We have information about that. We have obviously all the medical billing and collection dynamics of accelerating you generating revenue, which is what we do, the telemedicine contracts. Just schedule a consultation. Like, this is the time to talk to us. And that was not even a call to action we had planned for this call, but we have people who will do that. And Tom, before we get off today, and Hala, if you can give your guys' info to just schedule calls with the people on this line to just give a checkup and see where they are in their revenue cycling, getting the money, related to the programs from the government, telemedicine, any way that we can serve and support, building value for their practice and how they're capturing value, their restrictive covenants and innovation law audit, all as a complimentary quick discussion. This is for free as a value add as we're talking about giving, massive giving, but these are all checkpoints that matter. Does that make sense, Tom?
Yeah, absolutely. Very good. Yep.
Thank you, Sean. I want to shift to Dr. Reinkraut. So welcome again. So it sounds like from what I'm hearing from James as well as, hello? Okay, my screen shifted, sorry. From James as well as Michael, is that telemedicine is really, it's been made really easily accessible. It sounds like a lot of requirements like pre-certifications and co-pays, deductibles, pre-authorizations are done away with. You are currently practicing telemedicine. How has that been for you? How's the experience?
Yeah, thank you for having me, and nice hearing from everybody about some of these details. It has been, the talk of the town lately, how to do telemedicine, why to do telemedicine, keeping patients out of the emergency room, the hospitals, corona, but people still have all these other health issues that we still have to take care of. So it is a strange time. Keeping people and treating people with this technology is a whole new avenue. It has been available to docs for a while. It's been used more for like rural medicine for, a neurologist or an oncologist or a infectious disease doctor in a rural area, but now with corona and keeping people out of the offices, it's a great technology, and, making use of these technologies is terrific. I was in the hospital yesterday speaking with like a 75-year-old cardiologist and telling him how easy this is. It's really point and click. One of the things that, we have mentioned, I think Mike mentioned this, is the actual program that you're using. There's even been a lift lately that it doesn't even have to be HIPAA compliant. because they want people using it so much. So you can use Skype and FaceTime for these, in this period of the coronavirus. They just want docs using it to keep people out of the office, to keep people out of the hospitals. So, I do have a program that I use, which is terrific, and it allows me to take pictures and it integrates with my EMR. But, teaching some of these other docs how simple it is to use, and in this scary time, patients are just happy to see their doctor's faces and be reassured. So whether it's reviewing labs or giving people a regimen of, for me, I'm a foot and ankle doctor, how to do stretching, how to do a dressing change, is there signs of infection? Does something really need to be seen? Is it worth coming, the risk benefit of, is it worth coming to my office, where I have had protocols in my office about, not having too many people in the office, not having, people can even wait in their cars, cleaning the rooms. Those protocols we're all doing, but emergencies still do need to be seen. And a video chat that's now nice that it's billable is a great way to keep people out of the office and reassure people that it's not an emergency. So this is one type of technology that is great that we've been thrown into, and now everybody's using it. But there's other technologies, like there's now remote monitoring. Everyone has these Apple Watches that can do an EKG now. So that's now going to be used and billable. There's another technology for foot and ankle. I do, limb salvage and amputation prevention. There's a mat you can stand on that tells you temperatures. You stand on this mat every morning while you brush your teeth. It tells you if one foot's hotter or one spot on your foot is hotter, that means that there's a very high percentage. It tells you can be a month to 6 weeks earlier before a wound happens, that hot spot is going to turn into a wound, because my patients with diabetes don't have skin on their feet. So taking advantage of this technology, another company I work with is Zimmer. I use a lot of their products and speak for them. They're coming out with a knee, it's not foot and ankle, a knee that tells temperatures. So, and will tell you if your knee is infected, it'll let you know that your knee is getting infected before, you even have the infection. So taking advantage of this technology makes us better doctors, makes us more accessible. And in times like this, we have to be fluid, be able to change with the times and to adapt. So this is one of those times where you have to keep up, and doctors can really help people and reassure people. Some of these, the great things are some of these codes, they do, like James mentioned, they do pay the same as it would in the office with using those modifiers. There's even another code. There's always the joke between lawyers and doctors. I wish I could get paid for phone calls. Now there is another code.
Now you're getting paid.
So the virtual check-in is another code called G2012, and it doesn't pay terrific, but even for a 5-minute phone call, as long as you document it, it does work. As James also mentioned, the new patients are a little difficult. Getting the the HIPAA and the allowing to treat, your intake paperwork. That's the pain in the neck. You have to have that.
How has the response been with new patients? Are you seeing new patients? Are they open to the concept?
I think it's a terrific, attractive way to get new patients for me, and I'm using it that way. But to be honest, it has not happened that much. I need to work on my marketing, making this, the word I use is frictionless, make people able to make an appointment, have a virtual visit without all the paperwork, faxing back and forth and calls, making this frictionless is a little difficult.
I like that word. Sean, where have I heard that word?
Yeah, that's a startup company we have, Doc, called Proximity, that is designed to create frictionlessness between professionals and people they work with. So that is a beautiful word, and we love that.
Yes, that is, make it easy for people. This makes it easy for people, especially now when they, shouldn't be. This has been getting worse and worse, this Corona thing. It was, if you're healthy and young, you can come into the doctors. If you have any upper respiratory, stay away. If you're older or immunocompromised, stay away. But now, everyone should stay away unless it's a real emergency. So this allows us to do that. So this is really using technology to, and
it sounds like the technology that's available, you're actually able to have a very effective telemedicine evaluation, consultation with your patient, right?
Yeah, Krista, if you would, put that picture up if you would. This is a televisit that I did. Are you able to put that? It's not such a pretty picture for breakfast, but it's what I do. You able to put that foot picture up with a televisit?
I don't know if she's able to, Chris. There she is.
So
Oh,
There it is.
this is a patient of mine. You can see I'm down in the corner. This is a televisit. And the patient is an older guy with diabetes, immunocompromised. They just did an incision and drainage because he's diabetic, neuropathic, had a wound on his foot. Those black things are stitches on the front, right under between the second and third toe is a wound. He didn't want, and home nursing doesn't really want to go to patients' homes right now. So, I instructed his wife how to do the dressing changes every day. It's in a global period, so I'm not getting paid for it anyway, but I know, I can keep him out of the hospital, out of my office by instructing his wife how to do dressing changes. You can take down that pretty picture now. You guys probably don't love these pretty feet, but so that kind of thing, keeps people out of my office by instructing. I can see it. There's no redness. I ask her, is it warm? Is he having any fever, chills? How's his blood sugar? That kind of thing. That's continuity of care, and patients are worried. My patients are always worried about losing their legs. Is this okay? Is this bad? Should I come in? Do I have to go to the emergency room? Keeping people out of the emergency room and out of the offices, it's a great opportunity. So
thank you.
Yeah, Doc, this is Sean Callagy. Real quick, thank you so much. And you're articulate, you're cutting edge, and I would be thrilled if you'd consider coming on the Unblinded Huddle. I mean, there's people from all over the New Jersey, of course, but the country and the world. And I think so many people aren't even clear on how present telemedicine is. And we had one of our clients in the program is a PR agent in the city, is very successful and dynamic, and is scared to death. She's got a medical issue, and she's not sure how to get to the doctor. I think it's something easily that could be evaluated through telemedicine. And it didn't even dawn on her. And I'm embarrassed to say, with this call coming up today, I didn't even say anything about finding somebody who does telemedicine. So I think it's just so still yet not in the consciousness. So if you're up for it, love to have you on the Unblinded Huddle at some point soon.
Yeah, thank you. Actually, I went on it like maybe 2 days ago. Maybe it was Friday. Hala told me about it, and I've heard about your talks and stuff. So thank you. I was on it, and I will continue to pop on those 8:30 calls. That's impressive, and I've been impressed with your group and learning how to talk about myself and explain what's available. So I appreciate it.
Oh, awesome. Yeah, no, thanks, Doc. You're doing a great job.
Thank you. For this also, for the telemed, it's so available in other areas. Like you mentioned, it's right in front. My dog had an issue. I did telehealth for my dog. You can get a hold of your vet. It's available, and it's just not being used as much. When someone calls, because I get more calls for cancellations than calls for appointments these days. I really put it on my staff. If they're canceling an appointment, offer them a televisit. Ask them if they, anytime they need something, call, because better than coming in. You were going to come here for a reason. What is it? Maybe I can help you via television.
Thank you. Thank you, Dr. Reinkraut. Thank you for being with us, and we'd certainly love to have you on again. I did want to reserve some time for questions and answers. I think there might be some questions out there. I also want to tell everybody before we get to the questions and answers that we will have another webinar next Thursday, 12 o'clock noon. I will be hosting Dr. Roger Sahuri. Please join us. This is going to be an ongoing weekly webinar. Thank you to my amazing panelists, one and all. You guys are awesome. Thank you, Sean. Again, thank you, doctor. I know you're busy and you're in surgery. And so let's turn it over to questions and answers. I don't know if Krista, are there any questions out there?
Hala, while people are typing, Doc, I have a question for you. In terms of reimbursement, what kinds of things are you seeing? Has it been seamless or frictionless? Or are you seeing denials from carriers? Are they paying what they should be paying? Like what's from a practical sense, how's the reimbursement going?
To be honest, I have not been doing it for that long, but I'm confident, especially with all these bills being passed, that we will get paid. I'm doing the modifiers, the 95 and this place of service 2. I expect to get paid the same thing. Unfortunately, the quantity is down a lot. I'm not seeing as many patients in my office, but this will help patients and my bottom line. So I am confident we will be paid, but there's usually a lag of a couple of weeks before Medicare or private insurances pay.
Okay.
Oh, I just, thank you. I don't know if I said it. So next week, Dr. Sahuri is a chiropractor. So we will have different specialties every week to see what, how it's like for different types of physicians practicing. So again, that'll be Thursday, April 9th, 12 noon for our next webinar. Thank you all. I can't see on my screen if there are any questions. It is also, I think our time is up. It's 11:01. I want to open the floor up for anybody who wants to add anything from my panelists. John, are you there?
Yeah, I mean, final for me is thank you to everybody. Number one. Number two, we're here at Callagy Law. Best way to contact us is call the office line, 201-261-1700. And finally, unblindedhuddle.com. That's unblindedhuddle.com. Is how you get registered and set up for the 8:30 a.m. daily huddles. And thank you, Helen.
Thank you. And also, if anybody needs to reach me, you can reach me at 201-916-0656. Thank you all once again.
Hala,
Yes.
Hala, can you hear me? Okay. No, I just wanted to add also, your next telemedicine huddle or webinar is on April 9th, correct? That's going to be
April 9th, 12 o'clock.
Okay. Well, this format, Tuesdays at 10 o'clock, we are going to continue at this time with ongoing medical revenue recovery webinars. Our next one is going to focus on the surprise medical bill legislation that came out at the state level in August of 2018. And we'll also be talking about the federal surprise bill that was pending, but obviously has been forestalled given all of the circumstances. So I just want to throw out there to everybody, our audience, on Tuesdays at 10 o'clock, be prepared to tune in to some upcoming webinars on a variety of subjects.
Thank you, Tom. Thank you all.
Thanks, guys.
Pleasure. Thanks for having me.